I found that there really wasn't any good evidence-based dental ergonomic education on the market. And that was about 15, 20 years ago. And that's when I started creating this evidence-based dental ergonomic and wellness education. Chest breathing is our natural stress response. It gets less oxygen to the body. And when the body reaches a certain minimum saturation point, it elicits that fight or flight, sympathetic nervous system response, and can lead to pain. The armrest can be so helpful in preventing neck pain and shoulder pain, especially on that non-dominant side. It's just really hard for a lot of hygienists to get used to using them.
Get ready for your unofficial dental hygiene podcast. These are the tales of two hygienists, one East Coast RDH and one West Coast hygienist. Listen as they tackle the profession of dental hygiene with humor and enthusiasm. Now, please join Michelle Strange and Andrew Johnston as they tell you a tale of two hygienists.
Welcome back, everyone, to another episode of A Tale of Two Hygienists, the podcast, episode number 238. My name is Andrew.
This is Michelle. I love that you're like the podcast. Even because that's probably a good thing to do, though, because we do have quite a few things happening.
Yeah.
Like we have our website with
the website. Yeah. All of those things.
Our social media, our library of all kinds of stuff.
That'd be awesome, actually, like for our social media, be like, this is Andrew from the Tale of Two Hygienists, the social media. The Facebook.
The Facebook. But then you'd actually have to do the social media.
Yeah. Well, look, I have plans in the next couple of weeks to do a little more social media stuff. And then I have in the past. So look, maybe that'll happen.
Well, you put it out into the world, so I will hold you to this now.
Okay. That sounds good.
All right. How is everything going?
Everything's going good. How's everything going with you?
I'm got delayed again with my seeing patients, so I won't be going back until
But as long as you have time to do your TikTok videos, I think that's the only thing that really matters in life.
Yes, I have joined the world of TikTok. I was actually talking to my friend yesterday because she was like, man, you have really jumped on that train. I was like, well, what I didn't realize is because when I first got on there and I was like, what is this whole thing about? You know, it's AI. So it like the longer you linger on a thing, or it'll start with like, I guess the most popular, but the longer that you linger or watch a video or hashtag or whatever, it learns that about you. So my first thing was just a bunch of teenagers dancing. And I was like, this ain't okay. This is and not for this 30-something-year-old here. No, I need to get out of it. And then I started seeing all these voiceovers and I was like, oh, tell me more, TikTok.
No. Wow. Okay. And now it's created. I think like AI has actually trained you to do some weird things. So that's kind of an interesting little backwards thing.
Someone was like, I didn't realize that you were such a ham. And I was like, yeah, I guess. And a lot of, dentistry has only seen me be kind of a science nerd and like very passionate about our profession. But I very much grew up dancing and being very theatrical and a little bit more extra. So this just kind of, it's normalized it now. And I'm like fully in it.
It allows you to be you. And you know what? I support that.
Thanks.
Yeah.
It definitely brings out like the old school dancer in me. But I will tell you right now, if I do or try or learn one of these dances, my body hurts for the rest of the day.
Just be careful not to break a hip, please. Actually, if you do break a hip, you can just sit behind the desk and podcast all the time. So I guess it's not really that big of a deal if you do. Break all the hips. It's fine.
It's fine. Yeah. But you're right. It has given me enough time to TikTok, which is what I was doing in the clinic when no one was there this last week.
Yeah.
Because I've been doing the infection control coordinator stuff for the practice. So you guys, if you are not the ICC or you're going to become the ICC, we have an infection control docu-series. I've been trying to document all of that out there that I've been doing at the clinic because it is hard. It is fragmented. And so hopefully if I can screw it up, and I have screwed it up, you can learn from me. So go check out the docu-series. It's on our YouTube, on our website, and also our Instagram.
Yeah. I think it's going to be really good. I'm actually really excited I don't get excited about all the stuff that you do, but I really am excited about this.
No shock there. So what? Go ahead.
No, I don't know. I wasn't really sure if I should like share news quite yet. There's some news coming up. I will tell this on the podcast. I did put in my 2-week notice at my job of 8 years. So there's more to come. Oh, what does she say? So like Leah always says, watch this space. That's what she always says.
Watch this space.
Watch this space, everyone. So yeah, so news to come on that part. But that's all.
Yay. Exciting changes.
We also might need to we also might need to do some rebranding. If just maybe. A little teaser. Maybe.
Wait, why would we need to do rebranding?
I mean, I'll tell you off air, but we're not gonna say it now because it'll just give it all away. But anyway, so yeah, watch this space. That's all my news. That's all I want to say about that.
Okay.
Let's move on.
Well, and continue to listen to this podcast because we're finishing up our ergonomic series today. Dr. Valachi is finishing out our ergonomic series. She did such a great job of explaining things. I love that she is a PT married to a dentist. And so she is just like, I'm going to find a way to make you guys healthy. Like this is going to have to work. And
it's awesome.
So it's fantastic. But what I love the most about it is that she really, took all the episodes from this month and it just kind of all came together in this last one. So that was really fantastic. So I'm sure you're going to enjoy this episode, and y'all take care of yourself.
Hey, Michelle.
Yeah.
It's time for the interview.
Oh, but I had something else to say.
We need to let the experts talk now.
Fine.
So listeners, this is going to be a fantastic interview to close out our series on ergonomics. And I think you've probably heard, and hopefully it's been ingrained into your brain, that we got to do something to take care of ourselves to have this long, healthy career, because us complaining about our shoulders, necks, wrists, all that stuff, I mean, that shouldn't be the norm. So I want to welcome a guest who has a very interesting little crossover. And Bethany, please tell me if I'm going to say your name incorrectly, but Bethany Valachi?
Oh, that's very good. Yeah.
Valachi? Is it?
Yeah.
Okay. Valachi. So Dr. Bethany Valachi, welcome to the podcast.
Thank you, Michelle. It's great to be here.
We appreciate it. So tell us a little bit about who you are, what you do, and why that applies to dentistry.
Right. So I am a physical therapist who married a dentist with severe low back pain, who at the age of 35 was forced to consider selling his dental practice and retire from dentistry due to the severe low back pain he had. So this prompted me to begin to do research, and I found that there really wasn't any good evidence-based dental ergonomic education on the market. And that was about 15, 20 years ago. And that's when I started creating this evidence-based dental ergonomic and wellness education.
Oh, that's so fantastic. I can't wait to hear how you helped him, because I think we're all struggling with that lower back pain. Probably, we'll get into this too, but I would love to know what the common things are. Because in my mind, I'm like wrist, left shoulder is my always guess, neck, low back. Is that pretty common?
That's it. And you nailed it, Michelle. It is predominantly with hygienists, left-sided neck pain, and that is due to constantly lifting the retracting or mirror side hand while you're working. and also the wrists. And it's interesting that in other countries, it's just reversed. Like in Sweden, they work in different clock positions. So the dominant arm tends to be, or dominant shoulder tends to be more painful. So it all depends on positioning and clock position and all of that. So definitely the neck, shoulder, and hands, wrists are the hot spots for dental hygienists.
Oh, that's so interesting that other country, like, I know we're going to get into it, but what does that mean? They work at different clock positions. I thought there was like only one way for us to see patients.
No.
But let's first get into like why this education is so important. Like, why do we need to care?
In dental school and hygiene school, I think, a lot of prospective students, when they went into hygiene school, they think, wow, this, I'm sitting, this is, looks like a great profession. I'm helping people. However, what they don't tell you in dental hygiene school is that the effort of your muscles to statically contract creates more of a workload than when your body is moving. So when you have these static, prolonged contractions, you're holding yourself chair side, the pressure inside the muscles rises. And as the pressure rises in the muscles, your blood flow starts to become occluded to the muscle, and a very painful ischemia and trigger points can develop.
Okay. And, what's so funny to me is the different types of education and understanding of this, because I know some people that don't believe that trigger points are even an issue or a thing. Have you heard that or had that pushback?
No, because like I said, this is 20 years of research I've done on this. Trigger points are very soundly based in the research. There's no gray area here. Trigger points it's common, it's well supported in the research. So one of the most common, go ahead.
Oh no, I was curious, how would you define a trigger point?
A trigger point is a hyper-irritable spot that develops in the skeletal muscle due to muscle work overload and dehydration. So in its healthy state, myofascia is kind of wet and gelatinous, kind of like hygienists can relate to this, right? Every Thanksgiving, you make your turkey, you lift the skin of the turkey and you stuff all those goodies underneath the skin, right? And it's all wet and gooey and gelatinous, right? When you lift that skin, all of that webby, wet tissue is myofascia. That's healthy myofascia. What happens in dentistry is that myofascia becomes dehydrated, and the skin and the muscle and the myofascia gets trapped together and adheres to each other, and it becomes very difficult to move, and it becomes a trigger point, a very painful condition develops. So that's why physical intervention is so important to release trigger points in dental professionals.
Well, my question was going to be, is it a fascial adhesion? So, and it sounds like that, because we did just have a podcast in the series on fascia.
Ah, good.
Yes. So I'm really learning so much about fascia and fascial adhesion and like Graston and ART. And those are fantastic ways to manage pain. At least I have found. I don't know if I interrupted you and if you had more to say on that, but I guess my next question too was, and we can get to that if I did interrupt you, but was like, how do hygienists typically manage their pain, and is myofascial release one of them?
Yeah. So the ones you mentioned, ART, the ones supported most highly in the research in order of effectiveness is first and foremost dry needling. That's what research shows is the number one most effective for neck pain trigger points. Okay. And the second, ART, third, Graston, and all of those are kind of about, those start to get a little less clear in the literature, but really highly supported in the research is the dry needling. So also manipulations, mobilizations somewhat, but not as specific. So I should say, mobilizations, manipulations for neck pain, not for trigger points. So,
right. Okay.
yeah.
Thank you. So when you say dry needling is mostly for neck, does it help with the shoulders and the traps and like,
oh yeah,
that's where I've actually had it. I'm a big fan of dry needling.
Yes. Dry needling is actually effective, on all the muscles in the body.
Mhm.
My doctorate research was on neck pain in dental professionals and the effectiveness of magnification. So I'm a bit of a nerd on this. So if I start to go down a rabbit hole, stop me, Michelle.
No, I love rabbit holes. Is that though the typical place or way that hygienists manage their pain, or is it also meds or like NSAIDs or analgesics? My issue, and I wonder if this is something that you see commonly in professionals, is that I was hyper stretched on one side of my neck and shortened on the other. And so it would hurt more. So I would stretch it more. And I was actually creating a bigger problem. Is that a common thing?
Very, very important, very significant. So there was a study done that showed that a right-handed dentist and hygienist tend to lean forward and to the right, right? Mm-hmm. This leads to muscle imbalances. Muscles become shorter and tighter on one side of the spine, looser and weaker on the other side. And this is why chiropractors are so popular among hygienists. But when we talk about treatment for myofascial pain, it's human tendency to take action after the painful episode, right?
Yes.
So of anyone out there, hygienists know that structural damage can be occurring long before the painful episode, right? And so this is why I have a 5-step sequence for preventing work-related pain in dentistry. And the first step is always resolving ergonomic challenges in the operatory to the best of your ability. The reason this is so important, I've seen a boatload of money spent on chiropractors, personal trainers, and it helps for a while. And then they go right back to the operatory that caused the problem in the first place. And round and round and round they go. They're just spinning their wheels. So we've got to optimize head posture with hygienists. You need to know the 3 criteria for selecting truly ergonomic loops, how to properly measure working distance, what types of frames are truly ergonomic, what clock position is ergonomic, how to position patients properly with a flat versus a double articulating headrest. Okay, I'll get off my soapbox. I'll go on and on.
Well, you're saying a lot of things and I'm like, wait, what? I'm going to have to take quick notes here.
Right.
So, I guess, is it possible to start with like the different positions, like patient positions?
Yeah.
Because I know we all learn, because I teach a lot and, we talk about that 9 o'clock, that 12 o'clock, lower anteriors might go here. So is that not best for us?
Yeah. So it's interesting. In some schools, I've heard hygienists say, well, I was taught to sit in the 9 o'clock position. So side sitting in the 9 o'clock position is the absolute worst position for your body, because it is the only position that you can possibly get into, chair side, that negatively impacts and puts every joint of your body that I can think of in a non-neutral position. And so you're side sitting in the 9 o'clock position, you're leaning to one side. Here is the time that I say side sitting in the 9 o'clock position is okay. It's when you're treating the deep, right, posterior lower pockets.
Deep right posterior pockets. So like the lower right
The
side.
lower right posterior. Mm-hmm.
And okay. And do you know if it's like the away surfaces or towards surfaces? So like the cheek side or tongue side?
Yeah, those would be the buccal.
Okay.
The buccal and occlusal sides.
Mm-hmm.
So I would say 10% of your time, that's great to spend it side sitting, 9 o'clock position. Okay. That's your goal. 10%. 70% of your patient treatment can and should come from the 11 to 12 o'clock positions. And a lot of hygienists are going to go, whoa, wait, I didn't learn that in school. There's no way that's possible. I have patients who can't recline all the way. It's possible. It's easier. It's going to decrease pain in the non-dominant shoulder. It's a 10-step sequence I teach at the dental school. We've got to get patients, first of all, tolerant to being reclined, right? The only way they're going to be tolerant is if they're comfortable. And this is the piece that is missing in most dentists and hygienists education as far as positioning, is that as physical therapists, we know that when you recline a patient supine and the cervical curve is unsupported, the cervical musculature goes into a state of chronic contraction and the patient becomes uncomfortable. And so these headrests and the positioning there is so important in gaining compliance of the patient to tolerating the supine position. And if you properly support the cervical curve, you gain control of the occlusal plane of the upper arch. When you're treating the upper arch, you can practically stand the patient on their head and they won't care, but you need to be properly positioning. And it's going to be different for flat headrests versus double articulating headrests.
So we all need to go into our ops and figure out what we got.
Yeah.
And double articulating means kind of like pulling up under the neck to give it support, going up, down, kind of the tilting back and forth. Okay.
Right. And so you can imagine then if you're treating the upper arch, we want that angled steeply downward and angled up into the patient's occiput. However, that's usually not enough with most chairs to make patients comfortable. So again, this goes into a whole patient positioning technique that I teach, where we support the cervical curve. That angle of that headrest the edge of the headrest needs to be placed just right so the patient will tolerate being reclined. So,
do you have any videos on that? Like, how do you scale certain areas of the mouth when they're in the 11, 12? Because I'm even like going, okay, wait a second. Where do I sit when I do a certain part of the mouth? I need to like reassess what I even do.
Right. So I have some videos at posturedontics.com. If you go to the Well Body system, you'll see excerpts from all of my online video training.
Oh, that's so fantastic. Because I'm sure, like myself, there's a lot of hygienists listening going, wait a second, how do I make this happen? Would you say a good first step is to have somebody maybe watch you see a patient?
Only if the person watching you knows what they're doing. I mean, watching as far as what? Maybe I'm maybe because I'm not always aware of where I sit with certain, because it becomes so autopilot driven at that point that I'm like, I'm truly like racking my brain, like, where do I sit? Yeah.
I think I just go into that autopilot and I almost think, or maybe I should film myself like seeing a patient so I can watch where I actually sit.
Yeah. So that is one of the things that I do is coaching, video virtual coaching sessions. And we actually take the webcam into the operatory and we look at treating a patient treatment. So definitely take pictures of each other. That's a great idea. You got your cell phone. Hygienists can take pictures of each other. It should be at from a profile angle so you can see the tilt of your head. We know that when your head is tilted more than 20 degrees forward, that is significantly associated with neck pain. So I would say probably 80% of the loops on the market don't have a steep enough declination angle to keep you in that safe head posture. And that is perpetuating a lot of the neck pain in hygienists.
We had Brent from Q Optics on as our first, and that's actually
wonderful.
The loops that I use. And I'm just a huge fan. I wouldn't know what to do without them.
Yep. Q Optics has, they have some really great attention to proper ergonomics and proper fit good declination angle. Absolutely.
That's fantastic.
Yeah. Mm-hmm.
So we are going to identify maybe how we sit, kind of reassess, get proper items to make us. So when we look at ergonomics, is that not just the patient, but like our stools? Are there certain dental chairs that are more comfortable for patients and for clinicians?
Yeah. So are you talking about patient chairs or
like patient chairs?
Yeah.
Because sometimes they're just so bulky. Like I couldn't even get all the way up against a patient.
Yeah.
And I'm 5'3" on a good day if I stand up straight. So it's sometimes I feel like they're just so far away from me.
Right. My two biggest criteria for selecting patient chair is it has to have a thin backrest so we can get the knees under there. Thank goodness the days of the big knob under the headrest are pretty much gone. But there are still older chairs and even newer chairs that are really thick, and it's difficult to gain access to the oral cavity without sacrificing your posture. But the most important criteria is a narrow upper backrest. And this is what's really missing on most dental chairs out there these days, because what's the first thing that keeps you from accessing the oral cavity in the 9 and 10 o'clock position? The first thing you hit is the edge of the chair, unless you have an incredibly obese patient, but it's 99% of the time you hit the edge of the chair. So you can actually retrofit some dental chair backrests with pedo or a narrow backrest. Yes, you can.
Oh, so a little less expensive, maybe a little easier than just trashing the dental chair that's a little older, because that's what I'm working with now.
Yeah.
But
you can.
Oh, go ahead.
So I'm sorry, if you get the narrower backrest, that's going to gain you at least 4 inches closer to the oral cavity. And when you're looking in terms of posture, that's a lot.
That's huge. Yeah. One of the other game changers for me was a saddle stool. I'm new to it. Like I just got one, maybe just like a few months before COVID happened, and I haven't used it since. I'm really bummed. But, like I said, I'm smaller. So sitting in those traditional chairs with the back and like the long, I was always sitting on the edge. They were never meant for my size. And now that I have this saddle stool, I feel like I can move, like I could adjust. Whereas before I always felt like, ugh, like I gotta like put your back into it and always like scoot around. And the saddle stool, it's like, oh my gosh, I don't even need to ever stand. I'm just going to like wheel around on this thing.
Yeah. So the saddle stool is a fabulous development for dentistry, because we know that in order to have good lower back posture and maintain your lumbar curve, one of two things needs to happen. You either need to be in constant contact with a good lumbar support. And tell me, Michelle, how often does that happen during your dental treatment, that you're constantly in contact with your backrest?
For about the first part of medical history and chatting with my patient. And then from a clinical, never.
Never, right? And so, we have these older traditional stools that have been around for decades with backrests and flat seat pans. Dental professionals even taller dentists, you're not going to use. Anyway, so that's been one of the perpetuating factors for low back pain in dentistry. And so the saddle stool enables a lumbar curve because it allows your thighs to slope steeply downward, and it puts your pelvis in a neutral position. So you're halfway between standing and sitting. So this works great for about 75% of hygienists. However, if hygienists are hyperlordotic, which many ladies are, it can actually cause low back pain and worsen low back pain. But if hygienists have the saddle and they have excessive lumbar curvature, there's a couple of adjustments we can easily make on the saddle to improve that so they don't develop pain or spinal problems. So
it would be in our best interest to maybe not buy these random saddle stools off of like Amazon.
as far as the position it puts you in, a saddle is a saddle is a saddle. I mean, they all look similar. However, there are hybrid saddle stools, which I get very specific in my education with what type of saddle, a hybrid or a regular saddle, is best for you, depending on your gender, your lumbar curvature, your height, your size, the health of your disc. Do you have a herniated or bulging disc? I would recommend a certain backrest for someone with a disc issue. So this gets, again, going down a rabbit hole.
No, but it makes sense. And it really falls in line with all the things that we say as professionals. There's more to just putting floss between your teeth, toothbrush in your mouth. There's just so many layers to health. And you're bringing up a lot of points that we talked about, even with the loops. Like, you just can't grab a pair, put it on your face. There's so much, we're all unique. Mm-hmm. And though maybe there's some that might work for a generalized population, a lot of us have these nuances that might make or break us if we don't follow them, or at least identify them and look for something that works for them. So have you noticed any changes in or new ergonomic challenges with COVID? Yes.
So I'm finding that a lot of team members are developing more, in addition to the work-related pain they already were experiencing, that there's an increased incidence of stress and headaches and fatigue. I'm creating a new webinar right now for just the impact of COVID and wellness and preventing work-related pain during the COVID pandemic. And some of this has to do with improper breathing and rebreathing of CO2 in these heavy masks.
And the N95, the respirators?
Mm-hmm. So we know that when the body isn't getting enough oxygen, this can lead to a stress response in the muscles and the body that can lead to work-related pain. So in the operatory, hygienists already tend to chest breathe. There's two types of breathing, diaphragmatic and chest breathing. Chest breathing is our natural stress response. It gets less oxygen to the body. And when the body reaches a certain minimum saturation point, it elicits that fight or flight, sympathetic nervous system response, and can lead to pain.
I would also imagine like hand scaling. And if you've never used a high volume evacuation prior to this, adding that has added some real ergonomic challenges.
Definitely.
Any suggestions on what we need to be doing to help counter what's happening with these N95s?
Yeah. So I teach, again, many different strategies in this webinar I'm developing, but one thing is we need to be doing deep diaphragmatic breathing when you're chairside as much as possible instead of this stressful chest breathing. We know that when you're doing proper deep diaphragmatic breathing, and some people think, okay, that's just pooching my stomach out, breathing down. No, that's not correct. And I teach a way of doing correct breathing using your transverse abdominals that helps prevent neck pain, low back pain, and sacroiliac pain. So it decreases the stress response. So it's very multifaceted, but we've got to be doing this properly, chairside, to prevent the negative impacts of these heavy masks and the PPE that hygienists are having to wear. So.
Well, you've said a few things today that have triggered me to think about previous episodes that we've had on the podcast. We know we've done a whole airway series talking about mostly for our patients though, but now we really do have to be mindful of our own nasal breathing, our own proper breathing that in these like you said, the heavy PPE. Also, we talked about fascia, and I would imagine tongue posture and things like that would matter as clinicians as well. One of the things that I have personally learned is that I have a horrible tongue thrust, and my tongue has never really been in the bottom, or it's always in the bottom of my throat. But like the stability of head, neck, and shoulder and everything, like it wants your tongue up in the roof of the mouth. And so we talk about this for patients, but we're our own worst patients, right?
Right. We are.
It's so terrible. In fact, I have burning tongue syndrome horribly. And for years, I've like just let it go and just dealt with it. And then found out like I'm severely vitamin B deficient. And I'm like, oh, yeah, I would never let my patient go that long.
Right.
This is horrible. So I'm just thinking like tongue posture, our airway, our breathing technique, the fascia, and like how we take care of ourselves when we leave and like what we're doing. There was one more thing that you said. Oh, and for patients not wanting to recline, 100% we got to make them comfortable. My other trigger that kind of brings up something and a conversation I have with patients when they don't want to lay back all the way is also their airway concerns. Mm-hmm. And I've taken few courses, and we've had Julia Worrell on and teaching us about like that fear that they get when they know they lay back and they can't breathe, and how irrational they are sometimes. Because they get so angry. I can't lean back that far. Don't put me back that far. And we're like, right. This is an irrational response to the chair going backwards. Right. But it's often fear induced because they're said like, their airway is collapsing because they are a head forward person, so that they can open up that airway a little bit more. And as we put them back, it collapses. Yes. And when you can't breathe, that induces fear. Yeah. So a lot of what you're saying is just kind of like trigger, like this pinging me like, oh, we've talked about that on that episode. And now it's kind of all coming together. And, also what we talk about, that whole body health and how it affects everything. It's a chain reaction, right?
It is.
So I'm also curious, what about armrest?
So armrests are very, very helpful in preventing neck pain for some hygienists. For some hygienists. So depending on the etiology of the neck pain. Mm-hmm. And so this is why I do a little test. Remember back when we used to do live lectures, Michelle?
God, it feels like it was years ago.
So I do this little test where we see if armrests would in fact be beneficial. What I would recommend for hygienists to do is, if you're going to order a saddle stool, order it with 2D telescoping armrests. And then if you don't like them, you just swing them out of the way, or you send them back if you don't like them. But you're moving around the chair quite a bit. However, the armrest can be so helpful in preventing neck pain and shoulder pain, especially on that non-dominant side. It's just really hard for a lot of hygienists to get used to using them. But ordering your saddle stool with armrests, just trying to get used to it for a couple of weeks, because that's how long your trial period should be from any manufacturer, and see if that works.
Are the armrests helping because we're not in that static, like at least we can kind of put some weight onto the armrest, and so we're not doing that chicken wing where we're in that static position? Is that what's happening?
Yeah, it's the upper trapezius. So the upper trapezius, when the arm is elevated, the upper trap is your shrug muscle, right? Mm-hmm. So when you are lifting the arm or reaching forward, it is constantly activated. And incidentally, the trigger points that develop in the most common trigger point in your body, in the hygienist's body, is trigger point number 1 in the upper trapezius, which refers a headache behind the eye. Okay, so when I do live lectures, I would say 2/3 of the audience of hygienists says, whoa, a headache behind the eye. That's what I've got. And it doesn't go away with pain meds. That is a referral from trigger point number 1 in the upper trapezius, which is the most responsive muscle in your body to emotional stress. And it's been shown to be the most active muscle during the delivery of dental hygiene care.
Oh, yes. Yes.
Right.
I'm curious. So if that's a more comment, is there an ergonomic setup mistake or problem that you see in most practices? Like if you walked in my office, Andrew's office, someone else, like, are we all kind of doing something similar that's not working for us?
Here's the common scenario I see is a double articulating headrest not being used or positioned properly. It's just sitting there flat. And when I asked them, do you ever adjust this? They're like, I didn't know I was supposed to. A lot of the reps don't even tell you how to position with these things. So double articulating headrest is flat. The operator is sitting in the 10 o'clock position, which is the absolute worst ergonomic clock position for you to operate from. And they are sitting usually way too low. And the thighs are close to parallel to the floor. They should be sloping 45 degrees downward. So think about that. 45 degrees downward. That is steep, right? That's halfway between standing and sitting. That's why a saddle stool enables most people to get closer proximity to the oral cavity. And check this out. It will allow you to face the patient in the 9 o'clock position so you don't have to side sit, which is really one of the most beautiful things about saddle stools for hygiene, in my opinion. So.
Oh, absolutely. And I was definitely taught parallel knees to thighs or slightly elevated. How does that happen though with super tall people? Do they need to get a different kind of chair? Cylinders?
Yeah.
Okay.
Yeah. So you, different stools have different cylinder heights. And so just as very tall hygienists need to be considering a tall cylinder, short hygienists, for instance, at the dental school, about a third of my dental students, we have to have a third of the stools retrofitted with a short cylinder because otherwise they're perching on the edge of their chairs. So if you can't sit all the way back in your chair, touching the backrest with both good weight through both feet flat on the floor, then either your cylinder is too tall for you or your seat pan is too long. And that's a really common problem in hygiene, is that the seat is too deep, because historically the average dental stool in the past has been designed for the average size European man.
Yes.
So who pulls up 70% of the time today, right? Chair side.
Yes. That's such a good point. I know you made a great point that we have to look at our everyday situation and fix those ergonomic challenges, because what's the point? It's almost like asking our patients to brush their teeth and then be like, sure, go eat sugar cane. No problem. Like, it's fine. So if we fix the ergonomic challenges in our practice, are there some things that we could be doing at home to strengthen and stretch, or what, kind of, I guess, I don't know, go against and correct a lot of the issues that we have and make in the op?
Yep. Definitely. That's a great question. The things that we can do at home are stress management techniques, and that includes cognitive types of exercises as well as aerobic type exercise. We know there's a very significant association between aerobic exercise and decreased stress. But it needs to be a specific type of aerobic exercise for hygiene, because we certainly don't want one that worsens your unique muscle imbalances. And this is something that that hygienists need to be really aware. Oh, let me answer your question first before I go down my rabbit hole. Controlling stress and the proper type of exercise to correct certain muscle imbalances to which hygienists are predisposed. So just real briefly to explain that imbalance is that dental professionals have stabilizing muscles, the lower and middle traps, that have to be targeted with endurance training in order to work all day with no pain in good posture, in optimal posture. In dentistry, dental professionals are prone to an imbalance unlike any other occupation in that with minimal, even a little bit of leaning the head forward, those stabilizing muscles fatigue very, very quickly if they're not properly targeted with the right kind of exercise. Then other muscles take over and do a job they weren't designed to do. And most hygienists listening to this will recognize these hot spots for pain: the upper trapezius, levator scapula, upper rhomboid. So if they go to a massage or physical therapist, it's like, yes, those are the hot spots. And that's the reason that those are the hot spots, is because they haven't been properly targeting the right stabilizer muscles, and these other muscles have to take over and compensate.
I've also heard that a lot of the discomfort comes from the pectoral muscles.
Yes.
Being so short and actually pulling forward and then overstretching those back muscles.
Definitely. So the pectoralis muscles, anterior scalene, sternocleidomastoid muscles get shorter and tighter. And so this perpetuates that neck pain cycle. So this is why I teach a very specific neck exercise for preventing neck pain. A lot of people learn the chin tuck, but most people are doing the chin tuck incorrectly, where you slide your chin back and make a double chin, because most people are actually worsening it by activating the sternocleidomastoid and anterior scalene.
Yeah.
So we have to palpate these. We have to do this in a very specific order to do this correctly and really strengthen the proper muscles deep in the neck.
Is this possibly what a lot of our patients are struggling with when in regards to TMD pain?
That's a great question.
Like a similar, like that head posture, especially with texting and phone use.
Yeah.
And sitting at a desk.
That's very likely. Yeah.
Yeah, I had a PT that was specialized in TMD in my area for a while. So we would send our patients there, and they worked a lot with their posture. Mm-hmm. And my patients were very successful with getting out of pain with it. Granted, we exhausted all kind of other options, but I kind of feel like maybe we should have done that in combination with the things that we were doing as far as a guard and occlusal adjustments and now we're looking at sleep. Like, gosh, a PT would have been fantastic to really integrate in that care at that time.
Yeah, it's a really multifaceted problem. Yeah, my husband does a lot of treating sleep apnea with oral appliances.
Oh, so great. So in a past episode, we talked about how great yoga is. Would you agree with that? And is there any other exercise regimens that might also be very effective for a dental professional?
Yeah. If you're going to choose a generic exercise at home to do, yoga is probably one of the best and safest for dental professionals. The reason I say that is that P90X, CrossFit, in fact, every generic exercise program I can think of has certain exercises that need to be taken out for dental professionals. We do not want to be strength training the upper traps, for instance. I mean, I know for a fact, P90X, CrossFit, they have strengthening exercises for the pectoralis muscles, strengthening for the upper traps, and that just throws the dental hygienist into the vicious pain cycle. So we need very specific exercise regimen for dental hygienists, which is why I developed an exercise program, home exercise specifically for dental professionals. So yoga specifically needs to have a few things modified for hygienists. For example, one of them is the downward dog, we know that hygienists are highly prone to hand and wrist pain. So when you're in that downward dog position, the pressure in the carpal tunnel is far greater in wrist extension than flexion, like in the operatory. So now you're putting the wrist in a much more vulnerable position, and you're putting your body weight, through it. So women are even more prone than men to hand and wrist pain and injuries. So if I were going to have a hygienist do the downward dog, I would have them in a neutral wrist position, for instance, holding on to a chair or something in that downward dog position. Does that make sense?
Or maybe like some weights or something, like just so that they could get their hand in that.
Yeah.
Neutral.
Just keeping it. Yeah. Whatever they can configure to put their wrists in a neutral position.
Okay. Well, that's so crazy, because I for a long time did not love downward dog or any exercises like push-ups that put weight on my wrist, because I always felt weak, and it was always my wrists that were giving me the biggest trouble. And I was like, push-ups are just not my thing, I guess.
Right.
But it makes sense that I was probably my wrists were not ready for that kind of flexion.
Yeah, I have a white paper that your listeners can download for free. It's 14 exercises dental professionals need to avoid. And they can get it at posturedontics.com/bonus. And when they register for that, they'll also get my free ebook, and they'll get my balloon breathing exercise that strengthens the diaphragmatic and that transverse abdominal. So remember, I just talked about the proper diaphragmatic breathing. It's my exercise for teaching how to do that properly, chair side.
That is fantastic. Thank you so much for that, because we are all needing it. I would love, as we are kind of closing out, you have so many great things, but I feel like what we need is that visual. So like webinars and going to your website, we could find and learn all those things from you there.
Exactly.
Awesome.
The first step is to get those 3 things for free. That ebook, the diaphragmatic breathing. So we need to be breathing properly chair side to prevent neck, low back, sacroiliac pain, downregulate that sympathetic nervous system response, and that exercises to avoid white paper. So those are at posturedontics.com/bonus. And that's a good first step to read the ebook, 5 steps to preventing work-related pain. And you'll see each of the steps. I give examples for each of the 5 steps for preventing pain and why they need to be in a very specific sequence. For instance, the last step is muscular endurance training, not weight training, not strength training, muscular endurance training, which has been highly associated with the prevention of neck and low back pain, specifically in dental professionals.
Oh, I need to look that up.
The reason this is step number 5 is that we know that if you do resistance exercise on muscles that have active trigger points, your pain will actually get worse. We need to implement these interventions based on the research. And I just can't emphasize that enough. You need to have a system that works. And this is a system that I've developed over 20 years of research. So, Michelle, I am not a clinical physical therapist. This is all I've done for 20 years full time is research work-related pain in dentistry. I wrote the book. I have over 80 published articles. I've done over 1,000 lectures internationally. And so I just want to stress that when your listeners go to purchase loops or purchase an exercise program, just look for the research. For instance, if they're going to buy a chair and the manufacturer says it's ergonomic, say, can you please show me the studies? Okay. So just ask for the research.
Now, this was a fantastic end cap to our ergonomics series and so many great points. And I do have one final question. I don't know if this is a rabbit hole or not, but you mentioned we get these trigger points when we're dehydrated. And I know I have suffered from dehydration because if I drink water, I have to find time to go to the bathroom, and I can't do both, seeing patients back to back. Right. And, this is a problem that we've created, and it has now become an industry norm, which I think is horrible. But how does our lack of nutrition and water intake really affect our pain management?
Yeah, it's a great question. And that goes in, it does go into a rabbit hole. So we start to talk now about the inflammation process. When we talk about nutrition and hydration and all of that, we talk about a metabolic process that we can impact with diet and hydration. So that's another podcast altogether.
Yeah, well, at least we can be mindful of it, right? And stop sending donuts to your referring practices, y'all. That is not okay. I don't know why that's become another industry norm. Let's just send crap to horrible food products to our referring practices.
I know, isn't that? I thought it was the most ironic thing.
Truly.
When I started doing in-office consultations 20 years ago, and I'm going, what's with all the donuts in a dental office?
Cakes and cookies and baskets and a lot of us are just in it, eating it. So we didn't, it's hard to have that perspective. But when you do step out, or like you coming into our industry and you go, the irony,
right?
The irony at the dental office is having all of these horrible snacks. So I think at the end of the day, you taught us a lot of great things. Definitely, listeners, go check out her website, Posturedontics. Is there any final, I think you gave us amazing tidbits. So if you don't have one, you just gave a bunch, but any last final words for our listeners?
Well, I think for hygienists, it's going to be obvious. Don't wait for the pain to occur, because I think most hygienists already are experiencing pain, but be proactive with this and start first and foremost with the ergonomics and realize this is a step. What you have to be methodical and wise with your implementation of your steps. And it's got to start in the operatory. Otherwise, you're kind of spinning your wheels. So that would be
That's awesome. Well, check out the website, everyone. Thank you so much for coming on and sharing your knowledge and your expertise to make us have a healthier, longer career, hopefully free of pain. It's so appreciated. Thank you so much.
Thanks for having me, Michelle. And everybody, I hope everyone stays well and take care of yourself and practice in good health.
So I know I am going to check out her website. I'm going to be doing all the recommended exercises that she's saying, because if right now if I'm not seeing patients, might as well build up my whatever needs to be built up so I can continue to sustain dental hygiene. It's rough, man.
Sure.
Have you ever had anybody that was like, oh, it's not that bad. You're sitting all day. It's just dental hygiene.
Oh, for sure. Oh, yeah. It's so easy. It's air conditioned in there. That's the thing.
Yes.
Air conditioned, you sit down all day. It's how hard can that possibly be?
Have you had that though from in the dental office? From a front office team or something?
I don't think so. I think it's mostly from outside of the profession.
I've had it from both, and I straight up want to strangle some people. I'm like, you don't know. My shoulder, my wrist, they'll never be the same. The kids, I'll never be the same.
Ain't that the truth?
I assume.
The only dental within the profession people have been assistants, and all of them, well, all three of them that I can recall right now, have all said I don't know how you guys do that. It's bad enough doing what we do. I don't know how you guys do what you do. I'm like, oh, okay, that's really nice of them to notice.
Well, what was nice early in my career, I did assisting and hygiene. So I had such a mix throughout the day. And my big joke was Monday, Wednesday, and what is it, Thursday, I lean this way, and Tuesday and Friday, I lean this way. So I feel like it kind of counter, because when I was assisting, it was just like a completely different, you had to lean the opposite way. And I was like, yeah, that was great. And then when I did full-time hygiene, I was like, woof, but man, if I had had all the things early on, the saddle stool, the loops, the ergonomic, like scalers, because I started early, even though I had the fatter type of scalers, the thicker handles. I went into a practice that re-tipped, and we had the old skinny ones. And I mean, there's just so many things that I didn't start out, even though I kind of learned it, I didn't take it serious, because I was like, let me get in there, let me get started making some money, and to do it again.
Well, I mean, gosh, the dissemination of knowledge has come a long way though too, right? Not just the actual,
so true,
the changes in the products and the changes in the thoughts and the changes in all the things, but like just that dissemination, like our podcast.
True. Well, anything else from you?
Not a thing.
All right. Well, we would love for you guys to rate and review us if you've been enjoying this podcast. Please share it with your friends. Tell everyone. We would love that very much. And you can follow us also on Instagram and Facebook. And if you haven't already, sign up for our newsletter. We send out all kinds of cool stuff and information. I think our favorite one so far has been our travel blog, where we kind of gave you guys tips and tricks that have made our travel so much easier. But we also have Science Sundays that we will send out, and all kinds of information. So if you love the podcast and you love learning more, subscribe to that newsletter. I think that's it. Or you can email us. Always email us, Michelle at ataleoftwohygienists.com or Andrew at ataleoftwohygienists.com. And our website is just that, a tale of two hygienists with an S.com. All right. Well, I hope everyone has a really great week.
Yeah. Take care, everyone.
All right. Bye, y'all.
Bye.